Hello, Professor and my friend. We are second-year students majoring in physical therapy in Faculty of Associated Medical Science, Chiang Mai University. Today, we are going to talk about the research about bone density and functional autonomy in post-menopausal women, submitted to adapted capoeira exercise and walking. We chosen this research because we think it's very interesting and we believe it can be applied in our everyday life with our patient and another. Our presentation is divided into 7 main parts. We will talk about the introduction, the purpose, procedure, statistical analysis, result and discussion, limitation and conclusions. Our presentation will last about 20 minutes. If you have any question, please save them for the end.
Introductions. Benefits of exercise. First, lower risk of developing stroke. Second, lower risk type 2 diabetes and preserving bone mass that reduce the risk of falls. Low bone mineral density (BMD) and physical inactivity are serious risk factors that may involve and lead to osteoporosis. It affects around 1 to 3 of postmenopausal women. And risk of falls, fracture of bone, and impact negative on quality of life. Minimizing impact of osteoporosis is walking and running. It enhances physical condition and improves bone mineral density or BMD.
Middle and high impact of osteoporosis is combat sport and adapted capoeira. Combat sport stimulate osteogenesis in bone tissue. Adapted capoeira preserve bone health, decrease the risk of fracture, and improve performance in the activity of daily living. The purpose of this study was to assess the effect of 2 training programs using adapted capoeira training and walking training on the bone mineral density and functional autonomy of postmenopausal women.
Experimental method. We received a total of 32 people who were tested but not in the criteria of 4 people. Therefore, a total of 28 elderly postmenopausal women. Inclusion criteria: being a woman in menopause, being in any phenotype group, descendant of European, Blacks or indigenous people, not engaged in regular physical exercise for at least 3 months, clear to engage in physical exercise. Exclusion criteria include any existing acute or chronic health condition, any type of invasive surgery in the previous 6 months, uncontrolled hypertension, early menopause due to ovary removal, the use of drugs that induce low bone mineral density, such as glucocorticoids. 28 elderly postmenopausal women were randomly assigned to the ADAPT Capoeira training group and the walking training group. Each group of 14 people then report the result before and after the test.
There is 3 pre-test programs. First is calculate BMI, body mass index. The preliminary procedures consisted of applying an anamnesis for sample selection, in addition to measuring height and body weight in order to calculate BMI for assess the subject's measurements. Second is assessment of BMD, bone mineral density. We using a dual energy X-ray absorptiometry scanner to evaluate BMD. The right femur and lumbar vertebrae level L1 to L3 were used to determine BMD. And third is to calculate GI. What to expect during a DEXA test? During a DEXA test, the subjects wore light clothing, were barefoot, without any metal inside or on their body, remain in the supine lying on table above X-ray generator. Legs are positioned on padded box to form an angle 30 degrees for 15 minutes. Images are taken of spine and hip.
Next, we are going to talk about assessments of functional autonomy. Researchers use the Latin American Developed Group for Maturity, or DDLAM, to test functional autonomy that include 10 meters walk, rising from a sitting position, rising from a ventral decúbitus position, rising from a chair and moving about the house, and putting on and removing a t-shirt. All the tests were applied twice at least 5 minutes apart, in which the best execution time was considered. The test results were used to calculate the TD-LAM Autonomy Index, or GI, and using following this formula to access functional autonomy.
Let's move on to the next part. Now, I would like to draw your attention to experimental procedures that mention between walking training and adapt capoeira training. I will start with how to exercise by walking training. Walking training is aerobic exercise. Use time 60 minutes per day, 4 to 2 times per week, session for 6 months. That with stretching and joint mobility exercise 10 minutes. Next, walking with exertion control between scores 3 and 5, or moderate and hard, on the perceived exertion scale on Berg's category ratio 10 for 40 minutes. Then, make muscle relax and stretching exercise for 10 minutes. The Berg scale is a way of measuring physical activity intensity levels. Perceived exertion is how hard you feel like your body is working. It is based on physical sensation a person's experience during physical activity.
Next, we are going to talk about adapted capoeira training. Adapted capoeira training is aerobic exercise. The training session consists of 6 stages. Use time 60 minutes per day and 2 times per week. Step 1. Warm up 10 minutes. Step 2. Basics movement 10 minutes. The video shows Ginga movement, that is basic movement of capoeira. The subject sideway movement, dodges, and movement involving the arms and legs.
You can step parallel, so from here you keep going 1, 2, 3, and only switching your arms.
Step 3 is squats 10 minutes. The video shows squats and pendulo of capoeira. The subject lateral side dodge, low dodge, slipping, bobbing, and low squat.
Step 4. Kicks 10 minutes. There are 4 types of kick. 1. Pontera. The subject straight kick with the foot to hit the target at waist level. 2. Benzal. Another straight kick with the sole of foot using ginga. 3. Geishada. The subject kick with the other part of the foot. 4. Meia lure differentiate. The subject kick with the inner part of the foot.
So from there you go. Kick, finish back.
Step 5. Variations 10 minutes. It is called Patcharada Wangnai. It's initial stand of the ginga. Moving forward, moving backward. The last one, step 6. Capoeira circle 10 minutes. The capoeira circle is a form of expression that makes it possible to learn and expand the game. In the circle, there are kicks, movements, and chants are enacted. All of videos are original of capoeira, but in this journal is adapt capoeira again.
Next, I will talk about the statistical analysis. The parameter of this journal is a student t-test presents on mean, SD, and graph at a p-value less than 0.05. Results and discussion. Descriptive characteristic of the group. This table will show you about the comparison of different variables among the sample. They have many variables, for example, age of menopausal, weight, height, BMI, sessions frequency, T-score at L1 to LT, femoral neck, total femur, bone mineral density at L1 to LT, femoral neck, and total femur, and the last variable is a functional autonomy index. Their comparison between ACT or Adapted Capoeira Training Group and WT or Walking Training Group. Next, I want you to focus on the last column, p-value column. This journal set p-value less than 0.05, so we can accept the variable significantly if a p-value more than 0.05, but we cannot accept if a p-value less than 0.05. Okay, for example, age in ACT group have mean 70.07 and SD 5.08. In the WT group have mean 69.14 and SD 4.17, p-value 0.601. The p-value is more than 0.05, so we can accept the age between groups is equal significantly. And in other variable, they have p-value more than 0.05 too. So we can accept other variable are equal significantly too. Results of BMD variable. This graph shows you about bone mineral density at the lumbar L1 to L3, neck of femur, and the total femur. Before training and after training in ACT group and the WT group. In this graph, I want you to focus on two sides. Firstly, the star is a comparison intragroup or pre and post training. Secondly, is the chart is a comparison intergroup or between group. If have sign on the bar, it shows you about increase of bone mineral density significantly. Okay, let's start with the star sign. At the lumbar L1 to L3 and the total femur, post-training of ACT group, they have the increase of bone mineral density significantly. Next, the sharp side. At the lumbar L1 to L3, neck of femur and total femur, between group, in the ACT group have the increase of bone mineral density significantly.
Next, I will talk about the result of GD-LAM functional autonomy test. First, look at the left paragraph. It is adapted capoeira training, and the right paragraph is walking training. Then the back bar is the result of free training, and the white bar is the result of post training. Next, in intra-group, the result of adapted capoeira trainings. All 5 tests spend less time, which showed better results, and intergroup have 3 tests is 10-minute walk test, lifting from ventral decubitus position, and putting on and removing a t-shirt, which show that the result of post-training of adapted capoeira trainings are better than the result of post-training of the walking training. This paragraph shows that after getting an adapted capoeira training has better results, and when adapted capoeira training is compared to walking training, adapted capoeira training has better.
Now I would like to draw your attention to the part of declassation. The first point, the result illustrated in Table 1 show as 1/8 in addition to the rapid decline in estrogen levels, show the greater need for physical exercise. The T-score depicted in Table 1 review BMD in lumbar segment 1 to lumbar segment 3 and femoral neck, but BMD in femoral necks were similar and the group were classified as having osteopenia of the femoral toe center. The second point, using different methodology in their research on judo, reported similar results for lumbar BMD and increase for lumbar segment 2 to lumbar segment 4 in the group. The third point, adapted capoeira training can have positive effect on BMD and functional capacity of postmenopausal women over a 6-month period. This may have happened favor functional capacity and the activity of daily living. However, the present investigation did not control eating habit or hormone level related to bone modeling, which may be a limitation of this study. Physical exercise provides benefit to the elderly such as muscle strength and endurance, mobility for the activity of daily living, and balance to the prevent fall. Finally, physical exercise have increased the mobility of elderly individuals.
However, the present investigation did not control eating habits or hormone levels related to bone remodeling, which may be a limitation of this study. Finally, let's move to the conclusion. The adapted capoeira training program for postmenopausal women was more effective for lumbar spine and total femur bone mineral density, and for functional autonomy tests in activity of daily living, when compared to the group submitted to walking training. As such, adapted capoeira may be an effective physical activity strategy for preserving the bone mineral density and functional capacity of postmenopausal women. More studies should help analyze the relationship between capoeira training, bone mineral density, and secretion level of hormones, such as insulin-like growth factor 1, estrogen, and progesterone, with decline post-menopause.
Thank you for advisor Mucharin Prasad Narong. And now is the time for the question. If anyone have any question, you can ask us in the KC module. We will happy to answer them. Thank you very much for your attention.